Minister of Health, Dr. the Honorable Frank Anthony, who will give us an update on COVID-19. But before we head into COVID-19, Minister, first of all, thank you very much for speaking with us. How are you today?
Well, thank you very much for having me on this program once again. I'm okay.
Minister, I know you are very busy, but before we get into COVID-19 specifically, there's another aspect. Recently, there was a survey by Unicef, and it spoke extensively of how it has been, COVID-19 in Guyana has been impacting our young people. And I know that your ministry is moving to put measures in place to deal with those. Could we get an update on that?
Well, UNICEF actually did 3 studies. They're what you call knowledge, attitude, and practice studies. And basically, they did surveys across Guyana, taking representative samples of people and trying to get a sense of what do they know about COVID-19, what are their belief systems, and to see whether or not what they know they're actually practicing. And based on that, they have made several recommendations. What we are finding out is that from these studies is that young people who are active in the economy and are going out there, most of them are not following the guidelines. And perhaps they believe that they are not at risk because the way that we have been talking to people, we have been identifying more more older people who are at risk for the disease. And from the deaths that we've been having, we see more older people are dying from the disease. Also, persons with comorbidities, meaning that they have some other underlying disease, they too have been at extreme risk. So perhaps the younger persons are thinking, well, this is an old people thing or somebody who is sick with something else, and they have not been paying a lot of attention to taking the necessary precautions. And from the information that we've been gathering with our cases, what we have noticed is that the majority of cases are actually between 20 to 30 years of age. And this is the highest age category of cases that we have, which is that younger mobile population. If they do not take the necessary steps at prevention, then more of these younger persons are going to get sick. And the big challenge really is that when they go home, if they pick up the virus, when they go home, if they have somebody who's elderly in the home, if they have somebody who is, have an underlying disease, whether it's a heart condition or hypertension or diabetes, they can easily infect this other vulnerable person who might be home taking all the precautions, but here is somebody who has been going from home to work or intermingling in the public and not taking precautions, bringing this disease into the home. And so to those younger persons, I want to say that they need to, while it mightn't affect them in a major way, they wouldn't get sick and be hospitalized, they have to be considerate and think about the other persons who are vulnerable in their home and in their family circle. Because if you take the precautions, you're protecting your family members who might be more vulnerable. So it's an important thing. And we have seen that this is one of the things that came true in the KAP studies that were done by UNICEF. The other area has to do with mental health, because a lot of people who are staying home and have been following these processes have been, you're at home, you have various challenges. And because of that, we want people, if they have difficulty coping, that the ministry's services are always available. We have hotlines that have been established, so these hotlines have been manned by medical doctors. And if people need such services, they should call the hotline numbers and talk to one of the doctors who are on call. So there are mechanisms that we are trying to put in place. But the main thing with these studies is that it allow us to get the, take these recommendations and try to put them in place so that, we can respond better to the public.
Right, Mensa, thank you so much. I know a lot of people were happy that a survey was done in this respect because, in fact, a lot of young people are being affected, and it's good that the ministry has, been doing other work aside from the usual. Talking about usual might not be an appropriate word, but in terms of COVID-19, where are we right now? If we can talk about some figures, where are we right now?
We have, as of today, we have about 2,700 and something cases of persons who have tested positive for COVID. So this is the total amount of people who have tested positive. Of these people, right now, there are about 752 cases that are active. And there's a regional distribution. So the area with the most active cases remain Region 4. And of the cases that are active in Region 4, the majority of those cases are from the Lusignan prison. So we have close to 200 and something persons who have tested positive at the Lusignan prison, and they have since been isolated. So they are separated from the general population, which would reduce spread because they no longer is within range of spreading to the general population of the prison. They would remain isolated. They have been observed by a medical team. And once everything is okay and they've completed that period of isolation, we would return them back to the prison, the general prison population. So that's an ongoing thing. We have also seen a spike in cases in Region 1, in particular around Mabaruma. And again, we have been taking more measures in that area, which includes more testing. Once we find positive people, we have been talking to them about how to do the self-isolation. And in some cases, if they don't have the means to self-isolate, then we will bring them into one of our government-run isolation facilities. We have also, in every region, we have teams of people who have been trained to do contact tracing. And so anybody who is tested positive, we go back and we try to reconstruct who they would have been in contact with over the last 14 days or so. So there's a team that would normally work on contact tracing. In a lot of cases, we don't get everybody because people don't remember sometimes. Sometimes they don't want to give us the information. But with the information that we have, we still work to see how many of those persons that the positive person would have been in contact with, that we are able to reach out to them, talk to them, and ask them to go into self-quarantine if the exposure was long enough, that they need to go into self-quarantine so that even if they were exposed, then we need to know that whether they're developing this disease or not. So self-quarantine allows us to observe them, and there's a period of time for that as well. So each region, we have trained personnel to be able to do these things. Some regions, it's more challenging than others because of the terrain and communication and things like that. But even with these challenges, we try our best to ensure that we are providing that level of service and providing information to people. So it would help us a great deal, especially in terms of isolation and quarantining of people, if we can have public participation. Because when we ask somebody to be in quarantine, they should be in quarantine. Their family members would know that they are ill, or have been exposed, and therefore they too should take precautions. And these things got to go hand in hand. And if somebody is not compliant, then they should inform us so that we can bring them into one of our quarantine facility. Because having people out there in self-isolation or self-quarantine, people need to abide by the rules, right?
Yeah.
It is important that they do that. If they breach those rules and go about in the public knowing that they are positive, then that's a breach of the law that we have there, because people are supposed to follow these rules that we have set up. And we'll depend very much on the public to report them to us,
Okay.
right? We are also in the process of looking at various electronic applications that have become available on the global market, and we have been doing some assessments to see whether those applications can be brought to Guyana and implemented here as well. So we've been talking to a number of stakeholders about it, and we'll see whether or not that can be implemented shortly.
All right. Those applications specifically, what will they do?
This will allow us to make sure that when we tell somebody to stay at home in quarantine or in isolation, that they are actually there.
Okay.
And if they move out from that area, then that raises an alarm with a central monitoring place, and people can respond more appropriately.
All right. Minister, if I can just take you back a bit, I know this has been said before, but just to reiterate again, the figures have been climbing, but there is a reason. Can you reiterate for us again why those figures are climbing?
Well, figures are going to go up if people are not taking the precautions to reduce transmission. So the simpler thing to respond to that is to say that, one, people need to wear their mask and wear it properly all the time. A lot of people are in the public domain interacting with people, they don't have on a mask, and that really is where you're going to get infected, because you don't know, if you are in a public space, whether a person there might be asymptomatic and they're spreading the disease. You don't know who you're next to, right? And therefore you need to take precautions, as well as the persons around you also need to take precautions by wearing a mask, by sanitizing your hands, by keeping your social distance. All these things are important. They sound simple, and maybe people feel that they're too simple to help to prevent anything. Well, these very simple measures can help to save people's lives, and they need to be followed. And these measures have been taught up by the WHO, the World Health Organization, because they actually slow transmission, right? These are the scientists that would sit, know how the disease are being transmitted, and come up with a set of recommendations that allow for us to, if we follow them, that this is what is going to slow transmission. So when people see those numbers going up, one of the things that people should ask themselves, am I contributing to those numbers going up, or am I helping to reduce those numbers? That's a question that people got to ask themselves. And if they ask themselves that question and they realize that they're not helping the process, well, then it's time that they start thinking about how they can help the process. And you can help the process by starting with you doing the right thing. Wear the mask, wash your hands, watch your distance. These are the things that you need to do. And then you need to extend that by encouraging the people around you to do the same thing. You know, encourage your family to do the right thing. Encourage your friends to do the right thing. Encourage your neighbors to do the right thing. There are too many people who take this thing for granted. So people, if you are in the same neighborhood and you see a friendly face, oh, well, I don't have to take precaution because I know this person. Well, you don't know where that person has been. You don't know who, where their interaction, you don't know where they're coming from, right? And you then decide, well, they're a friendly face. I can talk to them. I can take off my mask. I'll talk to them. And when you drop your guard like that, that's what contributes to spread. So yes, the numbers are going up, but the numbers are going up because we have too many people that are still not taking the precautions, right? And while in Region 4, as I said, the numbers have been up, a lot of those cases have really been from the Lusiktan prison. And because of that, you would see that the cases in Region 4 has really shown a spike, but they are in a specific place, and there have been specific measures that have been taken to curtail those numbers from rising. Because all of those persons who have tested positive are in institutional isolation. Those prisoners, they're all in institutional isolation, and so they would not be able to transmit or continue spreading the disease to anybody else.
Dr. Anthony, I wouldn't keep you much longer because I know you're very busy, but I just wanted to ask you now, Guyana's own health system is quite unique, but we're being compared to other countries. What could you tell us about how this government's management of COVID-19? Can you speak to that a little bit?
Well, the short answer to that is that each country would have its own epidemiological profile, and we have been working on it. We wish that we had all the resources in the world to be able to do some of this, but we don't. And the amount of resources that we have put it to good use, and we have focused it on where we think we are going to get better results. So, for example, we know that testing is important. We have put a lot of resources to do more testing, and we have seen the results of that because we are getting more people. We are able to find more people who have COVID-19. We find them, and then we take precautions to either isolate them at home or isolate them in an institution. We have been doing contact tracing. Contact tracing is one of the areas that we can do a little bit more of, and we have been taking some steps to improve our contact tracing in this regard. Because mechanical systems of contact tracing are problematic because you literally have to be following people all over the place. With new technology, there are newer tools that are available, and that's why I said earlier that we are looking at specific applications where we can electronically monitor people, whether they're home and things like that. So that's something that we are working on. In terms of treatment and expansion of our treatment services, this is another area that we have done quite a lot of work on in terms of expanding the hospital capacity, in terms of getting the medicines that are needed for the patients. So we have been working on this and making sure that we have all the medicines that are necessary for the treatment of COVID-19. In addition to that, we have been working with a lot of international partners to be able to get a vaccine when it becomes available, to bring that vaccine to Guyana. And so that's another area that we've been working on. Yes, there are going to be comparisons with other countries, but you have to compare apples with apples and not apples with oranges, right? So when you compare, you have to look at countries' socioeconomic conditions, size, population, and see whether or not those two health systems are really functioning. That's how you have to compare. But I guess we'll have more of these challenges going forward. I would say that when you look at what is happening in the Caribbean, let's look at what is happening in Trinidad, for example, and compare Guyana and see whether or not we are doing as good as they are or not. Compare us with Suriname. That's our neighbor. Small country, and they have cases like we have. They have challenges like we have. How are they doing? How are we doing? Compare us with maybe a bigger country, well, population-wise, like Jamaica. How are they doing? Compare us with Bahamas. And you will see that when you look at these things, that Guyana is not doing so badly, right? Of course, we don't want to have deaths, but this is a challenge globally, that once people get sick, a percentage of those persons are going to get sick enough and they're going to die, right? But these are challenges that we have globally with this pandemic. We are trying our best by providing the doctors with the tools, ventilators, medicines, and all the things that they need right now to respond if somebody get really ill and come to the hospital. But the way out of all of this is really to have people do the right thing. Help us to prevent the infection by doing the right thing, right? Wear your mask, wash your hands, and watch your distance. 3 W's. Simple as that, right? And if you do the right thing, then you're preventing the hospitalization, preventing people from getting into an ICU, and preventing deaths, right? So if we need to follow, if you like, the 3 W's and make sure that, you know, our population comply with them. And I think if we do that, we will see a drastic reduction.
All right. I have one last question for you, two actually. So earlier on you told me that there was a spike in Region 1 in Mabaruma. Could you say there talk that Region 6 is going to possibly be another hotspot? Yes or no? Would you be able to say?
From the epidemiological data that we currently have, we don't see that happening in Region 6 as yet. We have very few. Region 6 has been one of the places that has had very few cases, but we'll continue to monitor and continue to use the measures that we've been using. So as of at this point, there aren't many active cases in Region 6, right? And therefore, if we continue to put in measures, compliance measures, then Region 6 should be fine. So I don't know where whoever is predicting that we are having or going to have a spike in Region 6, I don't know what scientific information that is based on.
Okay, thank you. My last question to you. Since you've taken office, you've basically hit the ground running, as they say. I would like to ask you personally, you are a medical doctor, you're Guyanese, you're a husband and father. How important are your own health workers to you?
Oh, they're very important because they are the front line. They would prevent us from the rest of the population from getting sick. So imagine the seawall at high tide, right? If you don't have the seawall, then you will have a flood. So it's the same thing. If you have lots of cases and you don't have health workers to literally be there to deal with the sick, then you will have a lot of people dying. And that's the role, when we use the term frontline worker, it's literally, they are on the front line every day fighting this disease. And that is why we have ensured that frontline workers are getting adequate personal protection equipment so that their health can be protected. And we want to ensure that their working conditions and so forth are taken care of. In all that we have to do, we also have to make sure that these workers are well taken care of, and we are trying our best to do that. So I'm sure that many of them who I've interacted with understand that we are working in this direction. Some of these things take time, but PPEs and those things, we are not compromising on that. And we also want to give them the tools so that they can do their job better. And we have been able to provide those tools to them in terms of medication, equipment, and all the other things that they need to do their jobs better.
Okay, sir. Thank you very much. Well, we've just spoken to the Honorable Minister, Dr. Frank Anthony, who has given us an update on COVID-19. And as we heard from the Minister, it takes us collectively dealing with COVID-19. So once again, Mr. Minister, thank you so much for speaking with us.
Thank you.